Good morning, everybody. This is Professor Saskin. I'm here to show you how to do an assessment on an infant. Well, first thing you're going to do is you have to make nice with the infant so that the infant cooperates as best as possible. So you're explaining to the mother what you're going to do. You're just doing a general assessment. We're not doing anything invasive. So you want to cuddle the infant, make the infant feel comfortable, all right, for a few minutes. And when the infant seems to be warming up to you, you're ready to start. You want to make sure the room is warm, there's good lighting, and you maintain eye contact with the infant and the mother. You're going to start with a cephalocaudal exam from head to toe. You want to do the least invasive procedures first as far as vital signs to the most invasive so that the baby is quiet and you get accurate vital signs. So the first thing you want to do is you're just going to unswaddle the baby or undress the baby to the diaper so that everything stays clean. You have to make sure you're using the right size equipment. We have pediatric blood pressure cuffs. We have a tape measure because with infants you always want to measure the circumference of the head, the chest, and the abdomen for growth and development. Your thermometer and a pediatric stethoscope, which this is not. The pediatric stethoscope has a small bell so that it fits the baby's chest. So we're going to get started. The first thing I'm going to do is observe, because when you're observing, you can count respirations. Babies are abdominal breathers. So you're looking at the baby's quiet, maybe you take a little pacifier or your finger with a glove, let the baby suck on it, your finger. This also tests his sucking reflex at the same time. So I've counted the respirations for a full minute. This baby's breathing at 40, which is normal. And now I'm ready to take his heart rate with the stethoscope. So I put in my little stethoscope. I warm up my stethoscope and I listen to the apical, okay? You listen for a full minute to get the heart rate. Okay, this baby's heart rate's 130, which is fine for his age. The next thing I'm going to do vital sign wise is take his temperature axillary. Now, we do it axillary so that, number one, it's less disturbing to the baby, it's less invasive, and number two, we no longer do rectal temperatures except for maybe the first newborn temperature to check for patency of the anus. Okay, no fever. Then we're going to do the blood pressure. Now the blood pressure, I take my cuff, I coo at the baby to keep the baby calm. I wrap my cuff around the baby's arm, just like with the adults. You want to line up the artery to the artery, make sure the cuff is the appropriate size. Pump, 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 pump. All right, my blood pressure is 50/30. We're saying that's fine for this baby. Okay, we take it off. All right, next you're going to look at feel the fontanelles. Now, if this baby is a month old, both the anterior and the posterior fontanelles should be open. So on this baby, you can see there's the anterior fontanelle here, there's the posterior fontanelle here. These close. The posterior will close first. The posterior fontanelle closes between 6 to 8 weeks. The anterior fontanelle closes between a year and 18 months. You're looking for symmetrical features on the face. You're looking for patency in the nose. So to check patency, you press against one nostril and see how the baby breathes, and then the other nostril and see how the baby breathes. Babies are predominantly, at this age, mouth breathers because their nasal passages are so small. All right, you're looking at the symmetry of the chest, the clavicles, movement of the extremities that the baby does freely. All right, everything is fine. You then you listen to the abdomen for bowel sounds. You look at the groin, okay? And everything seems to be fine, no rashes. You check for pedal pulses. Remember, do not use your thumb to check for a pulse because your thumb has a pulse. on both sides bilaterally. Baby has good coloring, calm, depending on the age now. Neurologically, you would check for infant reflexes. So let's check for one of the Moro reflex. So you have the baby semi-sitting up, and you drop the baby and see if the baby startles. All right, just to check for reflexes. So that's basically what you would do with a infant and keeping it calm. Oh, Babinski reflex. Okay, the Babinski reflex, you're just going to stroke the outer sole of the foot to see if the toes fan out and upward. All right, and the reason you want to check reflexes is because you want to see the development of the central nervous system, because reflexes are outgrown as the CNS develops. Thank you and have a marvelous day.